Good morning, everyone. And today, our topic of discussion again, we are still doing hematology, and we started our discussion by discussing from the report of CBC, right? And we have pretty much discussed the conditions which can be related to um, RBCs, and we had discussed what is anemia, what is polycythemia, and how to approach the CBC. Now we are like as we are going to see the abnormalities of WBCs or abnormal white blood cell count to be more specific. Um, to start with, I must tell you that abnormalities in the white blood cells counts are pretty common. The most frequently occurring abnormalities we will talk about in this one. Of course, we cannot talk about each and every abnormality, but we are going to talk about the most common ones. So again, like I'm going to show you a CBC report over here, and we had discussed these two parts, and now our discussion is WBCs. And as I told you, like whenever it comes to the WBCs count, yeah, different books quote different readings, but what I remember is again this one 4,000 to 11,000 cells per cubic millimeter, right? So of course, like when our measuring is like per liter, so of course this values will change. But I remember in this one, and in this one you will see that they are not just talking about uh, the WBCs, but they are telling you how much percentage of them is neutrophils, how much percentage of them is lymphocytes, how much percentage of them is eosinophils, how much percentage of them is basophils, as well as the monoblasts, right? Now, of course, this one is like the not a normal type of CBC because the ESR is quite like too much raised and the monoblasts are too much increased, and you can see and the neutrophils are too much decreased, right? So I'm not going to talk about this abnormality, what this abnormality is there, but I'm going to tell you. So now the important thing here is like they can talk about, they can give you the things in percentages, and they are going to give you the count of these cells as well. So let's start with few terms. For example, first of the term which we I'm going to talk about is neutro uh, neutrophilia. Okay, and what is neutrophilia? Simply, when the neutrophils are increased in the blood, we call it as neutrophilia. And on the same side, when you found the word neutropenia, okay, so whenever the term is neutropenia, it means like decreased. So these terms will come again and again. So neutrophilia means what? Simply, uh, the neutrophils are raised in the blood, right? Now, one of the important thing, again, uh, as I told you, and I will keep on repeating this thing, different books quote different values. So when it comes to neutrophils, neutrophilia is when the are neutrophils are greater than uh, um, in the numbers. If I'll talk about per liter, 7.5, the 7.5 um, multiply by 10 raised to the power 9 per liter. Okay, so whenever the value is more than this, we said that like there is neutrophilia, means like the neutrophils are increased in number. So as we know what are neutrophils and what are the function of neutrophils in the body, if you know that, uh, of course, like these are two basic things which I am sure like you had already covered in the basic sciences, but for the revisions of many, of course, like what are the function of neutrophils, like they are very important. So neutrophils, simply, they are the most common WBCs, or you can say they are the one which are too much in number in the blood, and they are also called as the pulse of the blood, like simply, because they are they play a very important role in innate immune response. And whenever there is anything anywhere in the body, it is the neutrophils uh, which reach to the site, okay, which reach to that site, and uh, they started doing action. Uh, they have a short lifespan of hours, like you can say uh, 5 to 120 hours. Again, this value can be different in different books, okay, and they have very important functions. They have antimicrobial function, they can do phagocytosis, uh, they have chemotactic uh, uh, function, as well as they have a lot of enzymes in them. And whenever, what you can say, they are going to burst out, they are going to release a lot of enzymes which play an important role in immunity. So now, what are the causes of neutrophilia? In which conditions neutrophils are going to raise? So you can say common causes of neutrophilia means the neutrophils are raised in the blood. So there are many. The most important one is bacterial infection. So whenever there is bacterial infections in the body, neutrophils are going to raised in the blood. As well as neutrophils will be raised in many inflammatory conditions or in many inflammations, as well as in necrosis also they can raise. One of a very important example in this one is, for example, myocardial infarction. You will found that the neutrophils will be raised. When someone is getting treatment with corticosteroids, uh, the neutrophils are raised in the blood as well. In malignancies, they can raise. Okay, so of course, like here, maybe I'm talking about too much causes, but you must remember the most important first two or three causes. Okay, never forget them. Myelo proliferative disorders, proliferative uh, disorders, neutrophils will be raised, as well as some metabolic conditions are also there. For example, renal failure, uh, in which, what you can say, neutrophils will be raised. Okay, so these are the causes of increased neutrophils in the blood, right? And why? Because neutrophils, they are doing much important functions in the body. Okay, and uh, but never forget, like, they can be raised in bacterial infection as well as acute inflammations. Okay, so of course, like, bacterial infection also cause inflammation. So, but like, there are many inflammatory conditions in which they will be raised as well. So in necrosis or malignancies, they will be raised as well. So whenever, like, we get neutrophilia in the blood report, think about these conditions. And of course, you have to correlate these conditions with your clinical findings, with your history. If you have done history, if you have done clinical examination, and of course, like, we do CBC for some purpose. So whatever purpose you are doing CBC for, you are going to correlate this report with that. So remember, guys, like, we perform most of the time we perform the blood test in relation to some sign and symptoms or the conditions. So we have to uh, uh, it's very common, like, being a doctor, many people I know, they keep on sending me reports. They say, like, you will sometimes when you see your WhatsApp, you will found a blood CBC report, and they will say, like, can you please see what happened with this guy. So it's a different thing. You cannot interpret a CBC report without knowing what's wrong with the patient. So I always ask the patient, the person, that, why you get this report. First of all, let me know this thing, so that I must know why the person have the CBC done, or any XYZ report. So of course, like, it should be known. Okay, for example, if the person have done what you like, for example, someone who have done an ultrasound for a renal stone, like, because he have pain, and what I can see is like hepatomegaly, and the person will say, can you see this CBC report? And I will say that, he has some problem in the liver. So maybe he don't have any sign and symptoms of liver, but he had done to see either there is any renal stone or not. So of course, like, we have to interpret these reports in keeping in mind what the patient have uh, done that testing for, right? So on the other hand, uh, neutropenia, is when the neutrophils are less than now neutropenia is when neutrophils are less than 2 multiplied by 10 raised to the power 9 per liter, right? So we call that the patient have neutropenia. Now again, there are some many conditions or causes of neutropenia. There are many, but the most important one is like the people who are getting um, chemotherapy for some cancers, or people who are getting radiotherapy for any condition. Of course, like they have this thing. Sometimes it could be a adverse effect or side effect of you can say adverse drug reaction, you can say, or you can say like the side effect of certain drugs. For example, clozapine is one of them, and many other drugs are also there. Okay, and remember, neutrophils will be decreased in viral infections. Okay, so neutrophils will be increased in bacterial infection, but decreased in viral infection. And one of the syndrome which in which like neutrophils can be reduced is called as Felty syndrome. Now, don't uh, try to dig out what the syndrome is, because you are going to read this Felty syndrome once you will start rheumatology or internal medicine. And Felty syndrome is a very, very, very important, or you can say, a very interesting question, which come across you will come across in steps or PLAB exams like this. Like they love to ask questions about this one. But of course, like right now, because uh, we are not discussing this thing, so like I'm not taking you uh, well towards this side, right? So neutrophils, uh, like I was talking about neutrophils, okay? So you can see over here, normally neutrophils, like these are the normal values, right? Like normally neutrophils are the most abundant cells. Then there is lymphocytes, then there is eosinophils, then there is basophils, right? So we had done neutrophils. Okay. Uh, After that, what are the what you can say other cells which are present in the blood is lymphocytes, right? So lymphocytes. So now, when the lymphocytes are increased in the blood, we call the condition as lymphocytosis. Okay, we don't call it as lymphophilia, rather we call it as lymphocytosis. And lymphocytosis is when the number is, or when the lymphocytes is lymphocytes are more than, in this case, 3.5 raised to the power 10, like multiply by 10 raised to the power 9, okay, per liter. Sorry, we call that the patient have lymphocytosis, right? Or like of course increased lymphocyte count. So now, um, the important thing over here to discuss is, of course, sorry, uh, what you can say causes of lymphocytosis. Okay, so like when it comes to the causes of lymphocytosis, as I told you, neutrophils are increased in bacterial infection whenever there is body have any bacterial infection. On the same side, uh, when there is increase in lymphocytes, it is viral infections. Okay, think about that the person have some viral infections. Lymphocytes are also increased when we have chronic infections, um, like tuberculosis, right? Then there is uh, malignancies or blood cancers, which we say like blood cancers in our common language. For example, chronic lymphocytic leukemia. Okay, like it's a like in layman term, you can say it's a blood cancer. Okay, which generally is called as blood cancer or hematological malignancy. Uh, the short form is CLL. So chronic lymphocytic leukemia is the one in which what you can say there will be increase in lymphocytes, as well as lymphomas. Lymphomas. I'm sorry for this disturbance, but lymphomas are also a type of blood cancers. So these are the causes of lymphocytosis, and then there are some causes of um, lymphopenia. Now, this is the same term which we have already discussed, right? Same like you can say um, neutropenia. So we call it as lymphopenia, or you can say the full name. You can say lymphocytopenia. Okay, cyto means cell. So when the lymphocytes are less in the blood, the condition is called as lymphopenia or lymphocytopenia, right? They can both be used interchangeably. There is no difference at all. So, uh, basically, lymphocytopenia uh, is further classified into T cell lymphocytopenia, B cell lymphocytopenia, and natural killer cell lymphocytopenia. But okay, uh, we will not go into too much detail of that. But what we will do is like what are the condition in which there will be less lymphocyte count. So again, the people who have some uh, recent infections, okay, like common cold, um, the people who are using corticosteroids, okay, remember they are anti-inflammatory drugs, okay. A very important condition is HIV, uh, human immunodeficiency virus infection. Like they destroy the lymphocytes, okay, and that's why it occurs. And uh, plus, okay, it is not just corticosteroids, rather, you can say the people who are on immunosuppressive drugs as well. Like all the drugs, which suppress the immunity, it can lead to less number of lymphocytes count in the body. So, uh, this thing. After that, the next cells which we are going to study is eosinophils and basophils, right? So, eosinophils, as you can see, uh, they are not like too uh, much in the blood usually, okay, and of course, but they are a part of eosinophils, okay. They do play important roles in the body, right? So eosinophils, of course, like they are a part of immune system as well. And remember one thing, very 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 important thing. Uh, they are the cells which basically fight against parasites, as well as these are the cells uh, which are increased in many allergies. Okay, so uh, like eosinophils will be raised simply in allergic conditions as well as whenever there is any parasitic infection. Okay, so of course, like whenever there is too much eosinophils in the blood, I call it as eosinophilia. Okay, which means like the eosinophils are increased. Okay, and what we say that eosinophilia is when the number is more than 500 cells, uh, you could say 500 eosinophils, right, per microliter of the blood. Okay, microliter of blood. Okay, so when the number is more than this, we say that the person have eosinophilia. And what are the causes? The causes are simply uh, allergic disorders. As I told you, they play an important part in allergy. Okay, so okay. By the way, if we are going into the same, you can say I will write it like this: 0.5. Uh, they are the same things, guys. Doesn't make any difference. I'm just changing the values. Okay, before I was talking about the microliter, but now I'm talking about the liter, right? So allergic disorders, it will be changed, raised. Parasitic infections, it will be raised. Okay, parasitic means parasites. Okay, like ankylosing, what you can, sorry, Ascaris lumbricoids, Tinea solium, like all the parasites, you have done. Then there are some disorders like hypereosinophilic syndrome. Okay, and allergic, as well as allergic. Now, allergic conditions are many. For example, the people have eczema. Okay, things like this. Uh, okay, it could be raised in many type of malignancies. Now, I don't know how many malignancies you know from pathology, but for example, if you have done a disease called as uh, Hodgkin, Hodgkin lymphoma or Hodgkin disease, like in this one, your eosinophils will be raised as well. So, like this, and then there is a condition called as allergic bronchopulmonary aspergillosis. Allergic bronchopulmonary aspergillosis, like it's a fungal infection, which can lead to which affect the lungs, and simply can lead to eosinophilia, right? So, eosinophilia, of course, like there are many other causes. I'm not talking about them, but like these are the important ones which you must remember, right? So, this is like what you can say, the causes of eosinophilia. And now, uh, basically, uh, we have done eosinophilia, but we will not discuss eosinopenia. Why? Uh, because the eosinophils, if you will see over here, the normal value is 1 to 8, so they are two less in number, like when they are decreased. So basically, uh, it is not much noticed clinically, right, or on the labs. So that's why the causes of eosinopenia is not so important, right? So that's why we are not going to discuss eosinopenia. And the same thing with, if you will see over here, basophils. Okay, see the number is 1 to 4, right? So like again, like basophilia or basopenia is not so important. Okay, but what is important is basophilia. But again, basophilia is not so important. But okay, because we are discussing about the cells, so I'm going to discuss a little about them as well. So basophils. And now, again, for many who know, it's a revision. In fact, for many who don't know, again, like I will talk a little about basophils. Basophils, they are the least common type of WBCs which are present in the blood, and they are making like a very small number of cells in the blood, right? So now, uh, basophils are basically, they play an important role in inflammatory reactions or inflammatory responses to the body. For example, if you had done asthma, if you had done anaphylaxis, anaphylactic reaction, in pathology it is written in too much in detail, so you must know what is anaphylaxis. So basophils play a part in that one. Okay, so basically, uh, basophils have uh, they contain an anticoagulant called as heparin, right? So which prevent the blood from clotting, and they also contain histamine, uh, which is a type of a vasodilator. Okay, so simply, when the basophils are going to release these two things, what will happen? Number one, it will prevent the blood from clotting. Number second, it is going to cause vasodilation, so the blood will pass freely. So now, uh, like basophils, they play a very important role whenever there is an allergic reaction or an anaphylactic reaction. Okay, so they will be released in form of that, like in response to that. And basophilia is simply when the cells are more than, you can say, like the value here is 1 to 4. Okay, 1 to 4%. They are given in percent, right? So basophilia is simply when the cells are more than, basophilia is when the basophils, when the number is more than 0.2 raised to the power 10 raised to the power 9, okay, sorry, per liter, right? So we call that as basophilia. Now, what are the causes of basophilia? Simply, guys, I already told you, but to tell you here, um, by the way, like when we see the reports, we don't like this is the least type of, you can say, things we see when we are going to see the blood report, right? So basophilia is increased whenever the person have some sort of cancers or blood cancers or hematological cancers, hematological hematological malignancies, okay, as well as in response to many uh, chronic reactions, chronic infections like tuberculosis or allergic reactions. Okay, we can see the number of basophils will be increased, right? So, and like there are certain drugs which can increase the count of basophils in the blood, but like as I told you, that's not an important thing to know about, right? So, same thing. Uh, Probably the last type of cells which we are going to discuss today, uh, and then of course, like once we will discuss this thing from the next lecture, we are going to talk about other things. Okay, so um, what we can discuss is the last type of cells which are left is platelets. Okay, so platelets, which are also called as thrombocytes, as you know, and what are the function of platelets? I believe like almost it's something called as bare minimum every medical student should know by now. Okay, so same thing whenever the platelets are increased. And what is the normal level of platelets over here? What is written, if you can see over here, it is 150,000 to 450,000 per millimeter cube, right? So this is the normal value. Okay, when the number is less, we call it as thrombocytopenia. Okay, and when the number is more, we call it as uh, thrombocytosis. Okay, so very 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 important thing. So now you must know when the platelets are increased and what are the conditions when the platelets are decreased, right? So remember, guys, when the platelets are increasing, an increase in the blood, uh, the person is prone to get what he is prone to get um, thrombosis, okay, clot formation. And when the number of platelets are decreased in the body, so there is increased chances of bleeding in the person. Okay, so now you can say causes of thrombocytosis. Now, when I say cause of thrombocytosis, so it is obvious, like I'm talking about when the what you can say uh, platelet number is increased in the blood. So now platelets increase can be increased due to some primarily the condition is related to the blood, like the platelets can be increased in that conditions, as well as like the increase in the platelet number can be secondary to some other changes in the body or disease in the body. So we can say that first of all there could be primary hematological diseases in which like the platelets will be increased, and secondly it could be a reactive thrombocytosis, which is secondary due to the following conditions which I'm going to talk about. So whenever it is like due to primary hematological disease, uh, like in the blood, the problem is in the blood itself, so it is called as essential thrombocythemia. Okay. So essential thrombocythemia means like the platelets are increased, and it is like due to some, it could be some due to some genetic disorders and things like this. There could be myeloproliferative disorders, and it could be again a type of leukemia, blood cancer, or hematological malignancy called as chronic myeloid leukemia. Now see, myeloid, like myeloid cell line is the one which gave rise to the platelets as well. So in chronic myeloid leukemia, which is also called as CML, the platelets will be too much in number, and dysplasia. So these are the conditions in which like the platelets will be increased in the blood. And when it comes to secondary causes, then it could be secondary to many other things, like it could be secondary to infection, it could be secondary to inflammations, it could be secondary to malignancies, okay, it could be secondary to, for example, bleeding, it could be secondary to, like it can be raised in pregnancy, like pregnancy is a hypercoagulable state when there is what you can say more and more platelets, and it could be secondary to post splenectomy, like the people in which like they remove the spleen, they have increased platelet counts in the blood. And when it comes to the thrombocytopenia, what you can say when the platelet count is less than 150,000 per millimeter of cube, then what are the causes of thrombocytopenia? Simply, now uh, the platelets are reduced and the person is at increased risk of getting bleeding. Okay. Okay, and what kind of bleeding is caused when platelets are decreased in the number? Remember, the people who have less platelets in their blood, uh, they have superficial type of bleeds. Okay, superficial blood type of bleeds means what? Uh, they can present with petechias, they can present with ecchymosis, they can present with epistaxis or nasal bleeds, and females they have menorrhagia, or what you can say increased amount of blood loss during pregnancy, like during menses, right? So they can increase, they have more and more menstrual loss of the blood. So that is again a sign of thrombocytopenia. So now there could be two main reasons by which like platelets will be reduced. Number one, for example, if there is production, reduced production of platelets. Okay. Of course, when there is reduced production of the platelets, of course the problem will be in the bone marrow. Or number second could be when there is increased destruction of the platelets. So the platelets the formation is normal, but whatever is produced are destroyed more. So increased destruction of platelets is going on. So whenever like the bone marrow is producing less platelets, it could be due to infections, and most commonly it is due to secondary to viral infections. Okay, so remember uh, one of the example of that viral infection is called as infectious mononucleosis, in which what happens like the person they have less amount of formation of the platelets. Okay, or after the viral infection, the persons they go into thrombocytopenia and they have less platelets in the blood and they can have bleeding episodes as well. It could be drug induced, like certain drugs they can cause less formation of platelets. For example, penicillins can give the side effect as well. In the form of in many leukemias there is less formation of platelets. Why? Because in leukemias there are more and more other cells are formed, so platelets are less formed. Aplastic anemia. Now aplastic anemia is a condition in which like there is less formation of all the blood cells, so RBCs will be less, WBCs will be less, and platelets will be less as well as myelofibrosis. So as the name shows, like there is fibrosis of the bone marrow. So of course the bone marrow cannot produce any cells. Or you can say it could be bone marrow tumors. Okay. For example, multiple myeloma is one of the conditions you will study. Or you can say myelo dysplasias, like the bone marrow is not producing uh, normal type of cells. So all this one can lead to less formation of platelets. And whenever it comes to the increased destruction of the platelets, again, it could be immune mediated, it could be non-immune mediated. So whenever it is immune mediated, immune mediated, so it means like the immunity is the one which is destroying the platelets. So a very important condition, remember, which can present is called as heparin induced thrombocytopenia. And now this is also called as HIT, heparin induced thrombocytopenia. Like when we put the patients on heparin, what happens? Uh, there is immune mediated destruction of more and more platelets, and the person can go into a hypocoagulable state, or the person may present with bleeding. There is one more condition which I wanted to include here, is called as uh, idiopathic, idiopathic, like the cause is not known, um, thrombo thrombocytopenia, penic purpura. Okay, it is also called as ITP. Now, this is again a type of immune-mediated platelet destruction, which occurs due to many of the times due to infections in children, or it could be autoimmune condition in adults, in which the immunity our immunity start acting against platelets, and they will destroy more and more platelets. And what happens, like the platelet count decrease in the body, sometimes to such an extent that the person may started having superficial bleeds, or may present with some cranial bleeds as well. Okay, remember, like whenever there is less platelets, the person have increased chances of bleeding, and that bleeding can also lead to intracranial bleed. That is a very serious type of condition. Of course, like in that one, there can be brain hemorrhage. One of the condition is called as hypersplenism. So in this one, the spleen is hyperactive and it is destroying more and more cells, which will destroy platelets as well. One condition is called as thrombotic, thrombocytopenic purpura. Now, why? What is purpura? Purpura is like, whenever there is patch of bleeding on the skin, you can see if it is small, we call it as petechia. Whenever that patch is increased in size, we call it as purpura. Okay, maybe I can show you over here how TTP or ITP looks like. Thrombotic thrombocytopenia images you can see over here. See, this is superficial bleeds. Okay, you can see small petechias, you can see purpuras. Okay, so this is like example of that superficial bleeds. So or you can see over here. Okay, this is also a cause of thrombocytopenia, bleeding. So thrombotic thrombocytopenic purpura, in which there is thrombus formation and the platelets are consumed, and of course when the platelets are consumed, the patient presents with superficial bleed. One more syndrome, like, okay, this is also called as TTP, the short form. And then there is hemolytic uremic syndrome. The short form is HUS. Again, like hemolytic uremic syndrome, guys, they present with bleeding on the lower limbs. Okay, mostly pediatric patients. Okay, HUS, hemolytic uremic syndrome. So you can see the images of um, hemolytic uremic syndrome. So they present with what you can say bleeding skin. They present with see superficial bleeds. Okay, this is a photograph of hemolytic uremic syndrome. So in this one, like the platelets are being increasingly destroyed as well. Then there is a condition called as disseminated. Disseminated, like what is disseminated? Like widely spread, right? Intravascular, inside the vessel, coagulation. So it's a type of disorder, cannot be explained so quickly, but it is the short form is DIC. In this one, like there is the persons, they are having thrombocytopenia, and they can present with superficial bleeds or bleeding from different parts of the body. And it can also occur after massive blood transfusion. So simply, whenever you get a blood report telling you that the person has thrombocytopenia, you can think about these conditions. Okay, so these are all the conditions of thrombocytopenia. So, and of course, like it's a serious condition. So that's all about thrombocytopenia. Uh, One of the thing, guys, the platelets, they clump together. So it is very common that whenever like the persons, they get a result of thrombus, like the platelets are less in the body, in the blood. Always keep in mind that it is quite common that the cause of apparently like apparent low platelet count could be due to abnormality in the blood sample. So whenever we send a blood sample to the laboratory, uh, it should be containing anticoagulant. Okay, and when there is anticoagulant in the blood, the platelets will not coagulate, will not clump together, and then we may know the real number of platelets. Okay, so uh, uh, what what happens is, uh, we always send, you can say, I will write it down over here. So how to avoid, uh, whenever, you can say, the person is having um, decreased platelet count. Okay, whenever you found that the person have um, decreased platelet count, so you can say it is worth sending a citrated sample for the platelet count. Okay, for the platelet count. So now, uh, of course, like in those cases in which like there is, or you can say if there is unexpected in the person when which you're not expecting, but unexpected thrombocytopenia is there. So whenever you found like that the person have some thrombocytopenia and you're not expecting it, so always send a citrated blood sample. Okay, so of course, like what a citrated blood sample, what you can say do, it simply prevent the clotting. So nowadays there are the tubes which are available. It is called as citrated tubes. Okay, like nowadays, when we send the blood sample, we send it into citrated tube. So what is citrate? Basically, citrate is a reversible anticoagulant, right? It's a reversible anticoagulant. So simply, uh, what is there that uh, whenever we want to send the blood for clotting profile, we have to cover clotting profile in the coming lectures. Whenever we have to send the blood for coagulation profile, you can say, or coagulation assay, like the blood should not be diluted and things should not be like changed, then we have to take care. Okay, again, like we are going to discuss this thing in anticoagulation. Okay, so citrated tubes have citrate. And what is citrate? It's a reversible anticoagulant. Okay, and this one is like most of the time, the citrated tubes have uh, light blue cover on them. Okay, like this is to identify them, that uh, like this one is citrated tube. Okay, and that is of course used for coagulation studies, or when you are going to count the platelets. Okay, or whenever you want the real platelet count, so we send the patients the blood in these kind of blood tubes. So I hope you understand this thing, guys. So thank you for listening, and I will come back in the next lecture. Thank you so much.